Countries around the world are asking how to pay for healthcare more strategically to improve the quality, efficiency, and accessibility of health services for everyone. This is where the Strategic Health Purchasing Progress Tracking Framework comes in. The framework provides practical guidance for countries to assess healthcare purchasing in detail, from resource allocation to the behavior of health providers, which can influence how people access healthcare. The framework has been used in more than 20 countries so far, and this toolkit may help you use the framework in your country too. Most countries have more than one health financing scheme. Each one collects and pools revenue to purchase health services for its beneficiaries. The framework will help you analyze multiple health financing schemes so you get the big picture of how purchasing is affecting the whole health system. To apply the framework in your country, we've broken the process down into 4 steps. The most important thing to remember is to be as inclusive as possible when applying the framework, because purchasing affects a lot of people. The first step is to plan and prepare to increase the chances that your findings will be used to improve purchasing. To do so, you'll need to know stakeholders' objectives for using the framework. Why does it matter for your country, and what do policymakers want to achieve? Speak to policymakers and other stakeholders to get them on board and document your shared understanding. By the end of step 1, you will have set up your research team, which may include key stakeholders who will help guide the study, make decisions on what schemes to include, and share findings with those who need to hear them. The second step, data collection, involves looking for existing information through desk review and interviewing stakeholders with new insights on strategic purchasing in your country. This is an iterative process. Data collection naturally leads into the next step, analysis and validation, which will reveal gaps in your data that guide further data collection until you are able to generate useful findings, conclusions, and recommendations. The third step is data analysis and validation. The framework helps you to organize the data you've collected in a way that allows you to get an overview of how the schemes interact across the whole health system. The team finds gaps that would require them to go back and collect more data. Finally, the team compares schemes and applies strategic health purchasing benchmarks to identify opportunities for making purchasing more strategic and harmonizing across schemes. Next, you'll validate your analysis through external reviewers. You may also validate the recommendations with a cross-section of stakeholders knowledgeable about their scheme and purchasing practices. By the end of step 3, the study team will feel confident of their findings and conclusions, paving the way for step 4. The fourth step is sharing findings for decisions and actions. In this step, consider your target audience. What do they need to hear? What matters to them? Then, tailor your messages to fit their knowledge and needs. Think about the best way to grab your audience's attention and communicate clearly. Policy dialogue is a key way to get your findings used for decisions and actions. The purpose is not to criticize, but rather to encourage reflection on what is happening, what is working well, and what needs to change. By the end of this step, you will have shared your findings with key stakeholders who are in a position to use your findings to make health purchasing more strategic. Although this is the last step, it doesn't have to be the end. You can repeat this process every few years to see changes and identify progress. What does success look like? Local stakeholders make health purchasing more strategic, so the health system progresses towards its long-term objectives of universal health coverage. It's about discovering how to use those findings to improve purchasing and ultimately access to high-quality health services.